Hello, and welcome to Med Evidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we are talking about osteoarthritis. Degenerative joint disease is your body's squeaky wheel. I have this cousin who despises maintenance. He will happily order a new bike to ride, but refuses to do even basic upkeep like lubricating the chain, cleaning the gears, or even just inflating the tires. This means his bike is creaky, squeaky, and slow, and that its drivetrain rapidly deteriorates in a manner similar to degenerative joint disease. Degenerative joint disease, or DJD, is a common condition that affects somewhere between 14 and 44% of people at some point in their lives, with higher rates for people with knee injuries and those who are obese. The condition describes progressive changes to tissues within a joint, including the cartilage at the end of bones, the fluid lining between bones called synovium, and the bones themselves. Risk factors for degenerative joint disease include age, sex with women at a higher risk, family history and genetics, medical conditions including high blood pressure, obesity, increased bone mineral density, and inflammation, joint issues including deformities, unequal leg lengths, injuries, and surgery, and high physical demands from things like occupations or elite sports. The most common form of degenerative joint disease is osteoarthritis, sometimes just called arthritis. People with osteoarthritis can experience several symptoms, including pain, stiffness, swelling, and dysfunction of the affected joint. These symptoms and the joint degradation can make for an uphill battle in daily life by affecting joint function, mental health, sleep, and employment. DJD can quickly spin out of control for many people. Osteoarthritis and other degenerative joint diseases are like a peloton of related joint problems that reinforce each other in the worst possible way. One of the key components of DJD is stress to the joints, especially the knees, hips, hands, and spine. Along with misaligning a joint, stress can cause damaging inflammation inside of joints and bones themselves. Stress may be a factor in changing bone thickness and shape near a joint, which doesn't allow them to be as flexible as needed. At the cap of each bone in a joint is a protective, low-friction flexible layer of cartilage. Cartilage is strong, but has a limited capacity to repair. In the presence of joint stress and other risk factors, cells can mistakenly release degrading enzymes and inflammatory chemicals. On top of this, immune cells in the joint fluid itself can become overactive, signaling for more inflammation. Together, cells in the bones, cartilage, and synovium fluid can all enter a feedback loop where they collectively inflame the joint, degrade protective cartilage, and lead to bone rubbing directly against bone, which causes pain, damage, and deformity. Degenerative joint disease isn't the result of neglect or poor joint care, but looking at my cousin's bike may help understand what's going on here. He doesn't align his gear, rides on the beach, and doesn't even bother to rinse or lubricate the chain. As a result, the chain is out of alignment, causing stress on the gears. This could cause damage over time, but the problem is exacerbated by sand throughout the chain. Sand degrades the little lubrication left by the manufacturer and acts like sandpaper, filing the gears down and causing a poor fit. This creates a feedback loop where the chain doesn't seat correctly, sand can accumulate around the gear teeth, and the chain misalignment amplifies into a rapidly degrading, noisy, squeaky, and annoying bike experience. For my cousin, the solution is obvious. Be more mindful of preventative maintenance. Some of this advice may actually be helpful for those with DJD as well. The American College of Rheumatology and Arthritis Foundation strongly recommends several non-pharmaceutical approaches to treating DJD, including exercise, weight loss in overweight and obese patients, Tai Chi, cane use, supportive braces, and self-efficacy, a belief in the ability to manage symptoms and remain active. These are rough analogs to the preventative maintenance my cousin needs, though things like chain oil, which he has in the garage, I'll remind him, would also go a long way in helping. Similarly, several medications may be prescribed or recommended, including NSAIDs like ibuprofen, steroid injections, capsaicin, acetaminophen, duloxetine, and tramadol. These treatments are only recommended selectively, depending on the specific joint and patient affected, and must be discussed with a doctor first. Otherwise, it might be like my cousin putting chain oil on the brakes. Not a great idea. Unfortunately, just applying chain oil to a sandy bike chain doesn't make too much of a difference. These medications mainly lower pain and improve function, but don't alter the course of the disease itself. Clinical trials are gearing up to investigate new medications that may help treat the DJD itself. There are many potential medical targets, including overactive immune cells in synovium, inflammatory molecules in the bones, signaling molecules and enzymes in the cartilage, and medications that may help rebuild damaged cartilage. With the help of researchers and volunteers, we may be able to unseat this damaging condition for millions of people. With even more luck, we may even be able to teach my cousin how to maintain a bicycle. Thanks for joining us on this week's episode of Med Evidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com and check out the Med Evidence podcast for discussions between physicians and subject matter experts. Med Evidence provides evidence-based information that empowers individuals to make informed health decisions. The organization stands apart in the presentation of unbiased clinical research in clear, accessible formats guided by medical experts. Med Evidence provides education for patients and healthcare professionals with a focus on research as a care option. Note that information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you are experiencing any medical issue or have any medical concerns, you should consult with a doctor or other medical professional. My name is Benton, and we'll catch you next week.